Well, thank you very much for having me. I always appreciate getting to talk to people from outside the emergency medicine bubble. Um, Welcome and good morning, everyone. Hope you got a good night of sleep last night. I unfortunately didn't do the best job getting enough sleep. I got 5.5 hours. I'm very conscious of that, but hopefully I can get a nap later today and feel better from that. Um, but today I'm going to talk to you about this is meant to be a wellness talk. So this is really from your side. Um, but I think it is helpful to think about when talking with patients too. This is about sleep and how important it is. And it's something that I was inspired to start reading and talking about after like many sources of inspiration. I've read a book. This is a really fascinating and at times devastating work by Dr. Walker here, who's been a researcher at Harvard and UCSF and other places doing kind of the basic science of sleep research. And he compiled some of this and some of the up-to-date findings into this book that goes through. And a lot of what I structure the talk around is follows along with this book, adding some information that's more specific to physicians and how we deal with sleep or a lack of sleep. But it's really worth reading. It's well written and kind of inspiring to change how we think about sleep. So my caveat there is that I am not a neuroscientist or I'm not a sleep researcher. My understanding of brain science is basically what we all learned in medical school. So when I talk about different parts of the brain and what they do during this lecture, I don't want you to take that as a given fact and how things actually work. It's more of a framework for understanding and remembering some of the concepts and phenomenons that seem to happen. And just for the sake of presentation here, I can't easily see chats. So if you have questions, I can get to them at the end, or feel free to unmute yourself as well if you can't see me or you're having trouble with the slide and chime in with a question. So the goals and objectives of this talk, I want to discuss what drives us to sleep, review sleep's role in learning and emotions. I want to talk about how bad sleeping is and what happens to your mind and body when you don't, and review some of the things that people do to either mess up or get around their lack of sleep or problematic sleeping habits, so caffeine, alcohol, and sleeping pills, and provide some pragmatic tips on getting better sleep. And I want to talk a little bit about night shifts and what we know about what those do and how to do them better, which, spoiler alert, not a ton in terms of how to do them better. I suppose I should mention conflict of interest. I don't have any. Big take-home points. Take sleep seriously. I want you to get more and better sleep, and I want you to be part of changing the culture of sleep in our society, which I think in general has a little bit of disdain for sleep. But I want you to take for now just a few seconds, 30 seconds or so, and reflect on how your sleep has been in the past week. Maybe it's been excellent. Maybe something has gotten in the way. And just think about that. If we were in person, I would tell you to talk about it with your partner, which you can do. But have you been having to get up early? Are you taking care of small children that are keeping you up? Have you had some stressful shifts at work and you're having trouble falling asleep at night? And I want you to reflect that the recommended number of hours for a person to get of sleep every night is 7 to 9 hours. And we'll talk a little bit about where that comes from, but just think about what do you think the average number of hours that an American gets of sleep every night? And or what percentage of them actually hit that? Only 65%. And the average American gets around 6 hours of sleep every night. So, 65 are failing to get the recommended amount of sleep. And I think as I go through this lecture, hopefully it will be no surprise that there are, epidemics of mood disorders and obesity and diabetes, which are obviously multifactorial, but a contributing factor may well be the disordered and dysregulated sleep that a lot of us just have as a product of modern society. So my cats, though, are very good at sleep. They are incredible at sleeping. I want to first talk a little bit about the normal physiology of sleeping at a very basic level. There are two main systems driving your sleep. There is a sleep pressure from being awake, and there is also this diurnal variability with your sleep drive from the circadian rhythm, and it's driven a lot by light and dark. We are meant to more or less be asleep when it's dark and awake when it's sunny out. And that is driven by a number of systems in your brain, but a lot of this is related to the secretion of melatonin by the pineal gland. And this is regulated by light coming in. I'm showing the optic chiasm. Light comes in from your eyes, and that information hits an area called the suprachiasmatic nucleus, sits right above the optic chiasm, and that sends messages to the pineal gland about melatonin, and it suppresses melatonin when it's light out, and we'll talk about how important that is later. But you should start secreting some melatonin as it starts getting dim outside around sunset, 7 or 8 p.m. It should peak after midnight, and then it'll taper off in the morning. And this is one of the things that's driving your sleepiness throughout the day. The other thing is, and again, very simplified level, this is adenosine. This is like Samuel L. Jackson telling you to go the F to sleep. If you guys haven't watched that YouTube video with him reading the children's novel, Go the F to Sleep, I do highly recommend it. But this is a molecule that, again, in simplified terms, builds up in your brain the longer you've been awake and drives you to sleep. So if you look at a graph of, let's say, a 48-hour time period, your sleep pressure from just your circadian rhythm is going to vary, obviously, throughout the day, driving you to be more awake during the day. But your adenosine is going to build up throughout the day, and then as you sleep, assuming you get a nice 8 hours of sleep here, it's going to be cleared out so that right before you go to bed, you have this high distance between these two lines representing an enormous amount of sleep pressure to fall asleep, and you feel nice and refreshed in the morning at 7 a.m. when you're up and ready to go. Now, what happens if you don't sleep is that the adenosine continues to build, but you still get that variation in the circadian rhythm. So this explains why we will often get kind of a second wind if you're working an overnight and sign out time comes around 7 a.m. or whenever you happen to sign out. And you will notice that you feel more awake probably than you did at 4 a.m. when you were answering a phone call or a page. And we'll talk more about how one of the most commonly used drugs in the world impacts adenosine. But first, let's talk about sleep itself. I think I always knew that I felt bad if I didn't sleep. But yeah, I think before reading this book, I kind of thought of sleep as just the body being off and having a chance to rest, muscles to heal, probably something to sort itself out in the mind a little bit. But I never really appreciated it as being an active process with complex circuits and tasks that need to be completed for the maintenance of your brain to keep everything, this very complicated machine, running and functioning normally. And I want to impress upon you that even if you don't understand all the details, it's not just the brain being off. It is a very complicated active system. And we kind of, can intuitively guess that there's some complicated stuff going on, because even if we don't understand all of these different stages of sleep and what's happening, we know that there are different types of brain waves and different brain wave patterns and frequencies happening. And that's a very gross measurement of what's happening just with the surface electricity, obviously. But it's a complicated piece of machinery. So it's divided, this is a hypnogram, basically looking at your sleep architecture throughout the night, where you go through different stages of non-REM sleep and REM sleep, and it varies throughout the evening. You have some normal brief awakenings later in the night. And different parts of your sleep have different jobs. And I'm just going to talk about a few of them, which I think are particularly relevant if you're a resident or in training, or any of us really as doctors are still learning. And one of the most important things we do when we sleep is it's important for learning, and memory consolidation, and actually forgetting things as well. So again, when I thought about memory, which I started to think a little bit about in medical school when we were talking about some of these things and trying to memorize the things that people were telling me about memory. I sometimes felt like the man who knew too much, and there was just too much information in my brain. I can't remember anymore. At the end of the day, I'm totally saturated, and it is hard to take in new information. And I sort of assumed that gradually somewhere in my brain, this is getting moved from short-term memory, involving the tracts of the hippocampus, into slowly diffusing into the distributed areas of the cerebral cortex where longer-term memories are stored. I assumed that was a gradual process, just continually happening throughout the day. But it turns out that might actually be something that really only happens during sleep specifically. So one of the questions, or more predominantly during sleep, I should say. So one of the questions that people ask is, does sleep restore the ability to learn, to take in new information, to hold information in your short-term memory? So this experiment took two groups of people and had them memorize face name pairs that flash up on the screen. And then recall them, see how they do. Then one group got a 90-minute nap in the sleep lab, and another just hung out awake doing whatever, reading a book, playing a board game. And then they had them try and memorize new face name pairs. So this isn't recalling the original memory. This is actually trying to see, does your short-term memory, your ability to hold this new data, improve? And they found that the people who got a nap did 20% better. So they said, okay, that's kind of interesting. That's a first step. And this has been replicated over a full night of sleep, and it's shown to be impaired in sleep deprivation. And they have honed down on this with further experiments, and they actually are able to see these specific brainwave patterns, these bursts of electrical activity called sleep spindles that happen in some of the lighter non-REM sleep stages. And through experiments I don't really understand, to be honest, but they have sussed out what is happening and what parts of the brain are connected with others during these sleep spindles. And it actually turns out that they're actually seeing discrete packets of information being downloaded, in a sense, from the hippocampus to the rest of your brain. So actually short-term memory being consolidated into longer-term memory, and just being kind of cleared out of your short-term memory, so you have more available, working memory. And that, they have shown experiments that correlate with that. The number of sleep spindles you have correlate with your ability to memorize new things, and also your ability to recall things later. So these are emergency medicine facts that you might learn on a conference day. But all these facts that you're taking in on your conference day and trying to remember and use later, you will both have more ability to hold on to those longer term and take new information in with adequate sleep. And the important thing here is that a lot of these sleep spindles, they mostly occur in the lighter stages of non-REM sleep, which is more predominant later in the evening. So if people miss the last hour or two of their recommended 7 to 9 hours of sleep, they're missing out on the chance to learn. So that's one type of learning, which is that fact-based kind of learning. And there's also procedural learning. There's different specialties have a different degree of the procedural skills that they have, but either way, they've done experiments on, well, let me actually, it starts with an anecdote, which I think is compelling. Early in this researcher, Matthew Walker's career, he was giving a seminar on some of his early findings of about sleep and its importance and what happens with sleep deprivation, and learning. Somebody at the back of the room came up to him after the talk and said to him, "Hey, so I'm a pianist, and what you said makes a lot of sense to me, because I've found that when I'm learning a new song, I'll often get to a difficult point in the song, and I keep making the same mistake over and over, and I'll be playing late into the night, and I'll go to bed frustrated, having not been able to do it. But then when I wake up in the morning and I try to play again, I'm able to just play perfectly without effort." And this was kind of could have been a small statement, but actually, Matthew Walker took this and ran with it and tried to sort this out, and did some cool experiments, basically having people like type number sequences on a keypad that was in a tricky way and would often trip people up, and watched how that got better with sleep. And sleep basically takes these procedural kind of skills or manual dexterity things and moves them from being at a very conscious level where you're thinking about your motor cortex and consciously where each finger and everything are going to move and do, to circuits of motor activity that are below the level of consciousness. So it's kind of solidifying that. So there's a lot of adages out there. One of the adages is practice makes perfect, but really we should say practice with adequate sleep makes perfect. And if you're trying to learn some kind of new skill, you're really limiting yourself if you don't have enough sleep to consolidate that. Just talking about another aspect of normal sleep, there of course are dreams, and dreams are a little bit more mysterious, obviously, than some kind of basic memory maintenance functions of your brain. And they do tend to occur in the rapid eye movement phase of sleep. And if the other parts of sleep are kind of a cleanup crew for your brain, this is a wild, disorganized, chaotic time that often happens during sleep, when everybody is, for a few hours every night, floridly psychotic with loose associations, visual and auditory hallucinations. And what purpose does that serve? Well, it's kind of philosophical, and at some level we don't really know, but REM sleep is preserved across basically every mammal that we know of and have studied sleep in, and it does seem to play some important role. I think one of the ways to look at this is in emotional processing, which has been studied, and being a doctor is can be a emotionally difficult job with traumatizing experiences. So people have looked at how does sleep affect your ability to process emotions? And this is a cool experiment based on functional MRI, which I like quite a bit. So they take normal participants and they put them in the MRI and they show them emotionally charged images, whether it is a scary picture, a profoundly sad picture, a happy picture, or a neutral picture like this table here. And how they structured this is they took half the patients and had them do it at 7 a.m., be awake for 12 hours, see the photos again at 7 p.m., no sleep in between. In another group, they show the photos at 7 p.m., had them have a night of sleep, wake up at 7 a.m., see the photos again. And basically what they were looking at is both a subjective report of how strongly they responded to the photos emotionally, and also how their brain was lighting up in different areas that are important for fear and anger and things like that in their brain. And the area of interest here is the amygdala, which is one of these deeper parts of the quote unquote reptilian brain responsible for fear, anger, kind of basic survival instincts. And what they noticed is that in the group who got who slept overnight after seeing the images, when they saw the same images the next time, they responded with much less activity in their amygdala compared to the people who had been awake, who actually seemed on average to respond to the images a little more strongly. And this also correlated with the subjective report of how they felt. And the other interesting finding is that they looked at an area of the brain called the prefrontal cortex. And I believe if you want to get really specific, it was the medial prefrontal cortex. And they noted increased activity after a night of sleep. And the thought here, based on other experiments, is that the medial prefrontal cortex is sending inhibitory signals to the amygdala, and it functions better on a full night of sleep. And if you don't get enough sleep, your prefrontal cortex is quiet, allowing your amygdala, your angry, fearful part of your brain that's reactive and just snaps in response to things or gets really upset when somebody talks to you disrespectfully on the phone. That part of your brain is going to be more reactive if you haven't slept. It can't be kept in place by the kind of higher functioning parts of your brain. So how does this relate to us? Of course, this relates to us. If you have not been practicing medicine long enough to go home from a shift or hear about something that happened to your patients and it was just a very bad thing, and wonder if you missed something or you did something wrong or could have done that, and you go home replaying this in your mind, whether it's extreme examples, running a code or something like that. And what tends to happen is when you have a traumatic memory like that, it stays in your mind. And when you recall it, you're in the moment replaying it, and it has all of the same emotion that it had the first time you experienced it. But you'll notice that with every day, that emotion fades, or at least it should, as the normal part of processing this kind of thing. And it turns out that stripping of this memory of emotion is really seems to depend a lot on getting adequate REM sleep. So this is important for us, for being able to put these experiences behind us and remember it and say, oh yeah, this is a thing that happened and I learned from, but not be something that every time I think about this, I'm there replaying it again. And the pathophysiology of PTSD in many ways involves inadequate REM sleep, whether that is just that the stimulus, the traumatic memory is so traumatic that people get nightmares and they wake up and they have inadequate REM sleep to actually get through and process it. That's a big part of it. And also a big part of it comorbid with alcohol abuse, and alcohol impairs your ability of REM sleep to process these emotions as well. So important for you. The adage here is time heals all wounds, but that's actually not entirely true. It's really time with adequate sleep that heals all wounds. So let's go back to that 65% of Americans who are getting inadequate sleep. What bad things are happening to their brain in the state of sleep deprivation? Well, to look at this from, obviously, there's all sorts of subjective things and, more quantifiable ways to look at that in terms of reporting mood scores and things like that, which everyone kind of has known for all human history, that it gets worse when you don't get enough sleep. But it was really honed down by some of the work by Dingus and others at the University of Pennsylvania. And they looked at your ability to pay attention and how that's impaired in the state of sleep deprivation. And the experiments involved looking at a blinking light. And unlike this light, it would blink at random intervals. And the participants would click on a button every time the light blinked. And if you're in a rested state, that sounds pretty easy. I could do that for a while and probably be pretty accurate. But think about how accurate you would be after 10 minutes of doing that. I'd probably fall off a little bit, but probably do pretty well if I'm well rested. If I haven't gotten enough sleep, that's going to pretty quickly go downhill. And they basically look at the length and time it takes between the blink happening and people pressing the button, and also just the complete misses. And people start to have micro sleeps as they just miss whole periods of blinking lights. And that there is a dose-dependent relationship with sleep deprivation. And this is where the numbers came out of basically how much sleep do you need to have on average as a human being to not be impaired in this attention testing, is where those recommendations for 7 to 9 hours of sleep come from. And people need different amounts of sleep, but almost nobody needs less than 7 hours of sleep. There actually is a rare genetic variant that some people can do this test and work on 5 or 6 hours of sleep and be fine. But the prevalence in the United States population is fractions of a percent. So on average, that's probably not you. Maybe it is. Maybe you're an amazing person. I know it's not me. But to look at actually what happens, if you're up for 24 hours and in the morning, take this test, you have 400% more lapses. And so they've tortured a bunch of probably poor college students in sleep labs, doing these experiments with exposing them to different doses of sleep deprivation and finding equivalents. So if you get 4 hours of sleep a night for 6 nights, by the end of that 6 nights, it's like you've been up all night. So I mentioned the average American gets about 6 hours of sleep. How many nights of 6 hours of sleep do you think you need before it's equivalent to being up all night? And the answer is 10 nights. And so some people live like this, but just think about the fact that after 10 nights of sleeping for 6 hours, it's like you've been awake all night, and how impaired people are when they're awake all night. The other big point that I want to emphasize about these studies is when they asked these participants who just were sitting there, drool coming out of the side of their mouth as the light was blinking away at them and they weren't pressing the button, they asked them how they did. And they said, oh yeah, I think I did fine. I did most of it. Yeah, maybe I missed 1 or 2 or nodded off there for a second. People are unaware of the degree of their impairment reliably when they're in these studies. They don't know they're having microsleeps. And this affects a lot of what we do in our work. But one of the most important things, just as us as physicians, is how this is going to affect driving, because very brief impairments in attention while you're driving 70 miles an hour on the highway can have devastating consequences. And the number of too many doctors die every year in car crashes after night shifts that are, when you look back, seem to be related to sleep deprivation. So talking about impairment in another way, just to drive this home, in order to get my blood alcohol content to about the legal level of drunkenness where I couldn't drive, I would have to drink about 3 beers immediately in succession, which I could probably do on an afternoon off. That is equivalent to being 19 hours awake in terms of the same degree of impairment on this attention blinking light test. So as an ER doctor, if I, am working a night shift overnight, but I'm switching from day shifts and I've been up since 7 a.m. By the 2 a.m. when that rolls around, I will theoretically be as impaired as if I drank 3 beers on shift at 1 a.m. And I certainly wouldn't do that and go see patients. I certainly wouldn't do that and, talk to my boss or my colleagues about my work, or, at work anyway. The caveat here is that this is without any caffeine when they do these studies, and caffeine does, restore some ability or restore some of the impairment. But to what extent, it's not perfect. So that's a tension, which you can translate into our work and our safety driving, but also its effect on our emotions is really important. And I talked about this a little bit, simplifying the brain down to a couple structures. Again, oversimplification. The amygdala and the prefrontal cortex, like I talked about with the emotional reactivity and processing trauma, this is also just your kind of day-to-day functioning in interactions with your colleagues and nurses and things like that. Imagine you're on an inpatient rotation and that and a nurse asks you for something you don't think is really important or you need to be woken up for, getting in order for PRN Tylenol or PRN hypertension medicines is in the middle of the night. You're like, why? But how you respond to that phone call, whether you have a flash of anger and you're biting and nasty, or whether you're like, oh, okay, thank you for the phone call, I'll put something in. That actually probably depends a great deal on how well your prefrontal cortex is firing at the moment and suppressing your amygdala's ability to lash out at the people making you uncomfortable. So think about how that's going to affect your interactions with your colleagues and the people you work with. Just on a brief survey of some of the ways that it impacts physical health, it makes everything worse. Heart disease, we know from retrospective data on, I think it is a cohort of Japanese businessmen, there's a dose-dependent relationship between the amount of sleep and your likelihood of having an MI in the next year. I think it was workers in Britain who operated telephone like switchboard operators who were working night shifts. They had a much higher rate of cancer, the ones who worked the night shifts in the daytime. People had actually led to a class action lawsuit based on sleep deprivation. Some of the physiology, again, hand wavy from my perspective as not a cancer researcher, but the immune cells that you have performing their function of surveying the body for tumors and killing them before they become malignancy, those are found at lower levels in people who are chronically sleep deprived. So natural killer cells and whatever flavor of protective T cells. So in a sense, actually, you're in a state of immunosuppression when you're sleep deprived. If you stay up all night and then take a glucose tolerance test, you're going to be insulin resistant. Whether or not this correlates exactly with long-term development of type 2 diabetes, I haven't been able to sort that out, but I have a suspicion, and perhaps someone has looked at this in more detail, that these two are related phenomena. But don't take that too seriously. And mood disorders, there's no mood disorder that gets better in the in sleep deprivation. If you read the DSM, disordered sleep is often a criterion for major depression, mania, things like that. And it's a bit of a chicken and the egg in terms of does the mood disorder drive impaired sleep, or does the impaired sleep drive the mood disorder? And they probably are working together synergistically. What about just people's diet and weight gain? This is kind of a sad study too, where they took healthy participants and they exposed them to sleep deprivation or a full night of sleep in the sleep lab. And then they presented them with this buffet of food where they could eat anything they wanted, and it contained some healthy, nice-looking foods and some, sugary, high-calorie dense fatty foods. And they looked at what people ate and how much they ate. And the people who got enough sleep, they got filled up their plates with things that looked like that up top. And the people who were sleep deprived, in this setting, it was 4.5 hours of sleep, filled up their plates with things that looked more like that. And the people who were sleep deprived ate on average 300 calories more a day over the 24 hours. And if that were to happen every day, that would quickly add up to an additional 10 to 15 pounds of weight gain every year. And I know that anecdotally, this is true for myself as well. I just ate some junk food this morning after not getting enough sleep last night instead of my usual muesli breakfast. Let's switch over to medicine itself. So this guy is an infamous figure that we should recognize, and is responsible for a lot of the pain, I think, that we experience in medical training. And this is Dr. Halstead, one of the fathers of modern medical training, a surgeon down at Johns Hopkins. One of the pioneers of the idea of residency as a time where you live in the hospital and are totally effacing and are not sleeping, and totally devote yourself to getting all this experience taking care of patients so you can go on to be an excellent superhuman doctor. And he was famous for his ability to work on ends and do surgery after staying up all night and be up for 3 days in a row. The thing is, he was a very severe cocaine addict. And by the end of his career, really went off the rails, and a lot of his later writing was just incoherent and unintelligible, and he was in and out of kind of the late 1800s, early 1900s equivalent of rehab hospitals, and developed problems with alcohol and things like that, and probably died and ended his career much sooner than he would have had that not been the case. But this is kind of the legacy of medical training, and it comes, the most tangible effect of this is in night shifts, which if you're doing inpatient rotations, there are patients who need medical care at night. That's always going to be the case. And the old model was just tough it out and be there for the patients, and you can deal with a lack of sleep. But the culture of this has shifted some. Just to review, the kind of traditional call schedule was pick a number of days, 2 days, 3 days. One of the residents stays on at the end of their shift until the morning. This has been interrupted for interns because the ACGME rules forbid interns from working greater than 16 hours, as opposed to more of a night float schedule where a resident is basically nocturnal for, again, pick a number of nights at a time. And in the past, ACGME said you could only work 6 continuous nights, but they've actually changed that now, which I think makes sense. The reason being that it takes about 7 days for your circadian rhythm to shift and adjust to a night shift. So if you're flipping back and forth between nights and days every 7 days, it's literally the worst schedule for adjusting your body, because you're always off balance. An ideal schedule theoretically would be to, based on what we know, would be to work a full month or so of overnights, but that has impracticalities with it in terms of people taking care of children, and they tend to flip back on to days on their days off anyway, so it's imperfect. But this is what we have. A lot of the inspiration for that change in the ACGME rules was driven by this meta-analysis in the Annals of Internal Medicine in 2010, which compiled a number of different studies looking at various bad things that could happen with sleep-deprived residents, and on average, things favored worse outcomes in residents who were on a kind of overnight 24-hour awake schedule kind of after that. So things as important as inpatient mortality, serious medical errors, radiologic diagnostic errors. If you look at some of the specific studies that dig into this, it's an odd ratio of 3.5 for medical errors after a 24-hour shift. Odds ratio of 2.3 for crashing your car after a night shift, and 1.6 for needle sticks. Now, this data is all kind of necessarily limited. A lot of it's kind of retrospective survey based and subject to recall bias. Did you make any serious errors in the past week, and how much sleep did you get? But this has driven some of the changes in the rules. So I can't give you a perfect answer for how to fix this in one schedule that's best, because obviously there's so many factors that impact this. But it is very important about if you're planning a schedule or if you're making your own schedule to just sort of have that metacognition and awareness of the impairment that you have when you are sleep deprived, and how to get around that, whether that's asking for someone to look over your shoulder or using checklist or whatever other cognitive aid to help yourself when your brain is just not going to be as functioning as well as it should be. So what do people do about their sleep deprivation? So a lot of people reach for coffee. I know I do. I had some coffee this morning. The active ingredient being caffeine, also found in tea and some other plants. And the mechanism of action here is adenosine antagonism. So that molecule that's telling you to go to sleep, it's preventing your brain from hearing that message, at least until it wears off, but it's not getting rid of the adenosine. And once the caffeine is metabolized away, you have more adenosine than you did before if you haven't slept, and you'll feel even more tired. What I think is an important takeaway practically about caffeine is, if people, you study caffeine and people actually seem to learn longer and associate with lower rates of dementia and things like that. So it's probably not bad for you, coffee use in general, but you just have to be aware of it and use it smartly. The half-life of caffeine on average is 4 to 6 hours. Some people, it's much shorter. Some people are kind of rapid metabolizers, and there's a lot of genetic variation in this as compared to, some other ways we metabolize things. So some people can drink some espresso after dinner and, be going to bed 4 hours later and be fine. But me, if I'm, say I'm working this 3 to 11 ED shift and I'm dragging at, 4 or 5 p.m. and I need to keep my energy up, if I drink 100 milligram cup of coffee or 100 milligrams of caffeine, by the time I'm trying to go to bed around midnight, I still have 50 milligrams of caffeine in my system, and that's certainly enough to prevent me from falling asleep. And I've noticed this, and I've really cut back on my afternoon coffee, and I've noticed that I'm much more able to easily fall asleep when I come home from one of these afternoon or night shifts. Alcohol, I referenced a little bit earlier. It does have effects on your sleep architecture, long story short. People take it sometimes to help them fall asleep, and it does decrease sleep latency, meaning the time it takes for you to fall asleep after being in bed. But it also leads to more frequent awakenings. That hypnogram at the bottom is in those lines at the top where they're getting into wakefulness. It leads to fragmented sleep if one drinks a significant amount before going to sleep, which often people don't fall back asleep all the way when they have those awakenings, especially later in the morning. It does seem to decrease the amount of REM sleep that a person gets. There's actually debate in the literature about that, whether it actually has a net decrease or just delays the amount of REM sleep. But if people are waking up early and not getting later hours of their sleep, they're probably getting less overall. And they know that people in the throes of severe alcohol addiction, who are, the kind of people who are drinking a fifth of vodka every day, they get very, very little REM sleep. So it's bad for REM. So you may think that you're falling asleep better and getting better sleep by having a beer or a glass of scotch at the end of the night after a stressful shift, and it helps you relax. But you may actually be impairing your ability to rest and process the things that have happened to you during the day. And it also has a negative impact on learning. We're running low on time, so I'm going to zoom through this. This was sad for me. As a person who sometimes likes to go out on the weekend, they had college students and basically had them learn something on a Wednesday, had some of them drink that same night, had some of them drink a few nights later, say on a Friday or Saturday, and they had a group not drink at all. And they gave them standardized screwdrivers based on weight to get to a ideal level of drunkenness, and then tested them a week later. And the people who didn't drink retained 100%, but the effects on their ability to learn this new grammar system was pretty much devastated by getting just a little bit drunk. So use that information how you will, as you are early in your career and trying to learn a lot of things, and still a young person going out to bars on the weekend with your friends, which nobody can do anymore. So sleeping pills, I tried to get into this a little bit. The data is not super great. The author of this book I read that inspired this talk has very strongly feels anti-sleeping pills, and opines that they are not really sleeping pills, they are sedating pills. They do decrease people's sleep latency like alcohol. But actually, if you put somebody in a sleep lab and give them an Ambien, they don't seem to actually get more sleep overall. What they think they get more sleep because they don't remember waking up in the middle of the night with those normal awakenings that everybody has. And subjectively report that they feel more rested. But depending on the formulation, they can lead to more grogginess. There is a dose-dependent relationship between the number of sleeping pills used per year and a person's risk of death. This is correlation, not causation. But I would encourage you certainly for yourself to think about non-pharmacological alternatives to improving your quality and quantity of sleep before reaching for these. So what are some things that are actually helpful in the last few minutes here? Instead of setting an alarm for when you wake up, the ideal situation would be to set an alarm for when you go to bed, and be able to just wake up when you're ready to go with the day and not be woken up by your alarm. And in an ideal imaginary world, we don't have alarm clocks. We just wake up in the morning when we're rested and we've had adequate sleep. So I set that as a goal for myself, is that even though of course I set an alarm clock because I don't want to be late for work, I try to just have it be that I wake up before my alarm clock goes off. Screens. So the invention of the light bulb is probably one of the worst things that's happened for human sleep hygiene. But it's probably not as bad as portable screens that are shining this bluish frequency light into our eyes and really suppressing the secretion of melatonin by our pineal glands, and delaying our sleepiness until later in the evening than naturally would happen. I don't know if any of you have ever had the experience of camping or backpacking and being out for a couple of days, more than 3 or 4 days. You will. It's amazing that feeling of just irresistible sleepiness when the sun goes down, and that has something to do with maybe having a day of hiking as well. But I noticed that when I did that in a big hike I did before starting residency. And it's a very nice feeling, actually, to be totally ready for sleep at 9 p.m., which is not a thing that I can do while within the 4 walls of civilization. But the take-home point is that these things are bad for your sleep, and you should turn them off. You should turn your TVs off and your phones off, and not have them around in the hours before you're trying to wind down to go to bed. And you're going to find it easier to fall asleep at a time that allows you to get that 7 to 9 hours of sleep. dim light is better, warm light is better. Melatonin, it's so mixed, the data on this. You can read one study that shows it does help, and some studies that show it doesn't help. It does not work for general insomnia. Theoretically, it should work for problems where a lack of melatonin or delayed melatonin secretion is the problem, but unfortunately that's not consistent. But I would love to be able to tell you that, oh yeah, this improves people's quality of sleep when you take it the morning after a night shift when you're trying to sleep during the day. But people have studied that, and consistently it doesn't seem to have an effect. But then you look at some studies where they look at people who are kind of having problems with their circadian rhythm, where it's just shifted naturally. They're secreting melatonin at 2 in the morning instead of 10 p.m. in this, especially in adolescents, and this does seem to help them get better sleep in that setting. So it's totally mixed. Is it mostly a placebo? Possibly. Do I take it to help fall asleep during the day after a night shift? 100%. It's no evidence that it's harmful. This, though, is very important. Sleeping cold. Your body, when they look at it in sleep labs, it seems to be that the ideal temperature is about 65 degrees, and a lot of Americans keep their houses and apartments closer to 70. One of the things that if you get a sleep consultation, they'll probably tell you is just drop your thermostat a couple of degrees. Your body temperature naturally drops a few degrees in sleeping, and this can be very helpful. And just winding down, being mindful of the fact that the hours before you sleep is important, non-negotiable protected time. It is not time for answering emails. It is not time for getting one more thing done. Ben Franklin said this, I forget the exact quote, but never leave till tomorrow what you can finish today. And it talks about in his memoir about how you should, if you think of something, you should get out of bed and get it done and not leave it until tomorrow. And I think that is a typical American attitude, and the image of a high functioning, successful professional person is the person who's willing to burn the midnight oil to get things done. But I would say that that is not necessarily the path that leads to wellness and long-term health and happiness. And you may actually find that you're able to get more things done and enjoy it more if you have an adequate night of sleep the night before. So in summary, sleep is very important for learning all the facts, for learning the things that we need to do procedurally with their hands that we're learning. It's important for emotional processing. I want you to embrace sleepiness and not be running from it and chasing it away. Sleep cold, be thoughtful with caffeine and alcohol, turn down your lights, and try to avoid sleeping pills. Now, this is just one aspect of wellness. I've talked a lot about the factors that make up resilience, and a lot of that comes from the behaviors that you do around your sleep. But there's other things that go into it. There's your temperament, there's mental health conditions running your family, there's physical health conditions. So if even with you trying to do all the right things, you're still feeling like crap and really run down, you should see a doctor and not be your own doctor, because there might be something else going on that you need help with. But that's only one part of it. There's also external things, and you can call that support or abuse depending on the situation coming from your family, work, and society. And I think that we have a lot to do in terms of changing the culture of sleep and making it a priority, and it being a health crisis, this lack of sleep that so many of us are getting because of all the impacts that we know it have on people. So whether that is scheduling when work starts and commute schedules and when high schools start and what we're doing to adolescent brains by making them get to high schools at 7 a.m. to start their day when their brains are really not wired to be waking up that early. All those things go into this. I appreciate your time. I always enjoy talking this. Sorry, I'm running right to the end of the hour here, so I don't want to delay you guys, but happy to answer any questions, or you can email me if you want to chat about anything. Thank you, guys.